The issues on the healthcare.gov site are prompting Governor Walker to propose a delay in his plan for health care in the state.
Political reporter Jessica Arp joins us now with details on some of those changes, Jess.
Well, the governor had proposed moving some off BadgerCare and into federal exchanges to make room for other childless adults currently without insurance. That's all in lieu of a federal Medicaid expansion. But today, he says that plan will need to wait.
We're going to take decisive action to make sure that the people of this state, particularly people in need, do not fall through the cracks.
Governor Scott Walker says a special session is needed to delay changes that lawmakers approved in the state budget, moving 77,000 people above the poverty line off BadgerCare and into federal health care exchanges.
It would be easy to say it's their fault, not ours. We're not going to let the people of this state who are in need, who are relying on this safety net, to fall through the cracks just because the people who pushed Obamacare can't make it work today.
So we're here because of his refusal to start a Wisconsin exchange.
Democrats say while the delay is needed, they're questioning the governor's original plan, saying he should have taken federal Medicaid expansion funds.
If it's better to be on BadgerCare, why don't we expand BadgerCare and keep more people on it instead of letting them go to the federal exchange? I mean, it is a far better situation for Wisconsin residents and for other states who've already got this up and running, for their residents to be under a state exchange than to be holding to Washington's exchange.
The governor says his plan allows more childless adults to be covered and says a, quote, abysmal rollout illustrates his point.
The failure of the Obamacare rollout is precisely why I didn't take the Medicaid expansion in the first place. Because people, Republican and Democrat alike around the country, people who are taking the Medicaid expansion are depending on the federal government living up to their commitment, a federal government that can't even get a website up and going to get people signed up for Obamacare.
The governor said today he anticipates bipartisan support in both houses of the legislature when they take this up, hopefully in early December. Today, Senator Scott Fitzgerald said he was interested in seeing whether there was a month-to-month option that could be considered rather than a full-on delay until March. The governor said he'd rather it be a hard date instead of dealing with this issue over and over. He will officially call the special session, though, later this month.